In 2014, voters in Bernalillo County voted overwhelmingly in support of a tax to pay for mental health and behavioral health services. This came after the shooting death by police of James Boyd, a homeless man who was schizophrenic, as well as other shootings by police involving people suffering from mental illness. Now, this tax went into effect in 2015 and is providing up to $20 million annually for more programs. Correspondent Megan Kermick talks with city and county officials and a mental health advocate about what progress we have made in getting more services to more people in distress.
I'm joined today by Jim Ogle. He is a member of the Behavioral Health Task Force and former president of the National Alliance on Mental Illness Albuquerque chapter. Katrina Hotrum is Substance Abuse Programs Director for Bernalillo County, and Douglas Chaplin, Family and Community Services Director for the City of Albuquerque. Thank you all for joining us. Katrina, you are overseeing the efforts of the Behavioral Health Task Force. It's a joint effort between the city and the county. It's been nearly 2 years since this tax was implemented. And to expand behavioral health services, bringing $17 to $20 million a year, that sounds like a lot of money. What are the major initiatives approved or funded so far? Can you give us an idea?
Certainly. And just to let you know, over the past 2 years, we have been really working hard with our partners, including the University of New Mexico Hospital, in order to establish what is already implemented, and also the Human Services Department from the state, to determine what's already implemented so we could build on that.
So what do we have? Where are the gaps?
So yes. And so some of the things that have been approved so far are mobile crisis teams, and that is individuals that will be working with law enforcement officers, medical or mental health professionals that will be going on scene and working with individuals with behavioral health issues to see if we can divert and to de-escalate situations.
So someone calls us and my relatives in crisis, they would actually go out with the police.
That's right.
Okay.
That's right. Another initiative that we've worked on that hasn't cost us any money is with the New Mexico Crisis and Access Line. We, on the Bernalillo County side, have been working with our 911 dispatchers on transferring appropriate calls to the behavioral health line so that individuals are accessing that.
Okay.
In addition to that, we've approved and we are working on requests for proposals that will be coming out quickly on reduction of adverse childhood experiences, which is around $3 million investment.
So this is reaching kids who are young might be in traumatic situations, abuse situations.
Beyond reaching kids, we're really looking at supporting the families in these efforts, because we know that if we provide that child some stabilization and support, we can actually stop the cycle of abuse and hopefully have better outcomes for our children as they turn into adults. The other is youth transitional living, and that is really focused on homeless and mentally ill individuals that are living in our community that need some stabilization and supports. The investment is $650,000. Community engagement teams that would focus on individuals pre and post crisis that would go out. It's really a peer support model to work with individuals so that we could continue to stabilize them in the community. We have put about $3 million in supportive housing for individuals with behavioral health issues, and those are the big initiatives.
How has community input played a role in deciding these priorities?
That's a great question. So we have really been working hard between the city and the county and UNM to get community involvement. And the big way that we've done that is through our subcommittees. And our subcommittees are members in 4 categories, in housing, community supports, crisis and prevention, intervention, and harm reduction. And in that we have subject matter experts, but also consumers, family members, and people who are interested in the community that are sitting on these committees providing input on how we shape proposals. We have made a better effort at trying to get the information out to the community, which is one of the publications I think you'll be posting on your website as well.
Yes, we will. Yeah, we'll have that and other resources on the site. Jim, as an advocate and a member of the Behavioral Health Task Force, what do you see as the most pressing needs for those struggling with mental illness right now in Bernalillo County and their families?
From the point of view of family members and peers, I think what I would argue is dealing with serious mental illness, and things like mobile crisis teams are very important. The community engagement teams to go with that. So, and part part of where we're trying to push things is to minimize the interactions with the police, which is part of the reason that the community engagement teams are important. And some of the studies that will be done with the mobile crisis teams, we believe will produce information which says that we can have a mobile crisis team without the police, as well as I think one still will need the police involved with the mobile crisis team, but I think you might see a hybrid another year or so down the road.
I mean, this was one of the points in the Department of Justice report on the police here, was the interactions with people who are in mental crisis.
Yeah.
It's a big point of critique. We've had a lot
Yeah.
of shootings around that. So how many people are we talking about in Bernalillo County who might be struggling with mental illness?
If you look at the statistics for serious mental illness, it's about 4% of the adult population, which I think comes to around 22,000 or so for Bernalillo County.
I want to go to you, Doug. You are Mayor Richard Berry's designee to the Albuquerque-Bernalillo County Government Commission.
Right, mouthful.
Yes, that's working on these initiatives. I know city and county officials have gone to other cities to look at what they're called like crisis stabilization centers.
Correct.
And to take people who are in crisis, their family member calls, instead of taking them to the detention center, take them to one of these. Where are things with that? Are we going to do something like that here?
No, I think what we're really focusing on right now, and one of the messages and the big takeaways from places like Tucson, their suggestion to us was to make sure that you have the systems and the responses in place before you build a building. Because you don't want to build a building and not have the appropriate response to meet the needs of your community. And so over the last 2 years, we've been working very closely with our partners at the county, with folks like Jim Ogle in the community, with the University of Mexico Health, and the state to identify, as Katrina was talking a little bit earlier, what those gaps are and develop the programs that will be necessary in order to better meet the needs of the individuals experiencing mental illness at some particular point in time. So that was the big takeaway. And there's
I mean,
a lot of
they
work
sound
in that
very
area.
effective from what I've heard, if we can, it's an alternative to just taking someone to jail.
It's very much an alternative to taking people to jail, and we're working in a lot of ways to avoid that at all costs. The county just announced their resource center at downtown Albuquerque. Which
This
will
is the
serve
reentry center?
The reentry center.
Okay.
I've been working with the APD's been working very diligently on ways to avoid taking people to jail, alternatives to that. In fact, I saw statistics yesterday during a meeting that shows the taking folks that are experiencing some form of mental illness is significantly down over the last year or so. They're changing their culture in terms of how they approach these cases, and the way they're going about their day-to-day business is vastly different today than it was even 2 years ago.
And Katrina, we talked about the reentry center. So that's people who have already been in jail or the Metropolitan Detention Center. They're coming out. So why is that important? Because right now people just are discharged and they end up wherever they can find a...
Well, there's a couple of things, just kind of backtracking and talking about what Doug is. These partners, or what Doug said, these partnerships are so critical. And one of the ways that we have done a diversion program, we think successfully, is the partnership between the city and the county on our public inebriate intervention program. That happens over at my detox facility over at MATS for Bernalillo County. But in terms of what this resource reentry center is going to do, is going to really identify individuals who are high need, who are at risk of recidivating, and
Going back to jail.
Yeah, and really working with them while they're in jail if they're willing, and then having resources, connecting with resources so that we have a seamless transition into the community. That's one component. The other component is being a resource for everyone who is discharged. Warm place to be, charge your phone, what do you need help with? At some level of case management, we could probably be very instrumental. And, besides asking them, do you want a cup of coffee? Where are you going after this? How can we assist you? Did you know that there are these resources out there? And really trying to connect and bond with these individuals to see if we can get them steered in a positive direction and a change for their life. So we do have resources out there. This is really a big front door for us to access individuals who might be on the verge of having a crisis or don't stabilize well in the community. And how do we identify them and get the services that they need for them?
Jim, I mean, not everyone who has a family member with mental health issues thankfully winds up in the justice system. A lot of them do.
Right.
But what about the families of people with mental illness? Because in the past, they reach out in crisis situations. Sometimes those have ended tragically. What do they need? And do you think these initiatives that are happening right now are meeting that need?
I think there are two or three things. One is when a person really comes down with serious mental illness, and that's what I'm largely involved with, they don't understand what's going on. So they need some training, some understanding there. But the system also needs to be able to find these people and recognize the early symptoms and be able to try to divert them. So prevention,
Before they reach a break or
before they
something.
reach the break and before they really get bad. There's another thing though that the peers really need as they are going through this, and let's say they're living independently or with their families. And that's something to really work for, which means employment. And the real problem in the recidivism that you were talking about is people being able to get back into the job area.
Do you think these initiatives that we're working on are going to help towards that?
I think there are some things planned or being looked at to do that. I see it in some of the planning. I don't think we're there yet. You take this center for the people coming out of the jails.
Right.
And one of the things they really need is employment, and it's very difficult for them because they've been in jail to get that employment. So the employers in the community really need to sort of step up and be willing to work with the county and the city to try to do something there.
Doug, I know a key part of stabilization is housing as well, so there's plans to expand under that. The existing program that brings in supports?
Sure. So our housing is based on a housing first model, and basically the underlying idea there is that the housing is the foundation and the stabilization, and then wrapping the right services tailored for that individual's recovery to make them successful in that endeavor is very important.
So are we going to be, we're expanding?
We're looking at expanding
Units
that. And
or-
what we've been doing is, we've been doing this in a scattered site fashion. In other words, people get a voucher and they go find a place to live. We're currently working very closely again with the county and the university, UNMH, at a single site permanent supportive housing type of a development. And the neat thing about this type of a development is it give individuals a place to live that was designed and managed in a way that would be conducive to their recovery. It would be trauma informed, it would create safe places, it would create a controlled access or gated community for them and their success. And then it would have services, and we still need to figure out what exactly those services would be that would support the recovery of each of those individuals.
Well, Katrina, what are the next steps? What are we likely to see in the next few months? And how do we keep the community engaged?
Great. So you're going to see hopefully money rolling out into the
Okay.
community. So with these initiatives, again, we're working on a request for proposals and getting money out into the community so that we can start to see some effective change. The first one you're going to see is the reduction of adverse childhood experience proposal, which will be coming out. The proposal's already out, and we are looking at contract finalizations at this point. So you're going to see a lot of these initiatives that we've talked about coming to life.
The mobile crisis teams?
Mobile crisis
Okay.
teams, community engagement teams. And, we're, again, still partnering on the housing pieces. But I think in the future, you're probably going to see more effort into prevention and teaching and training and getting the community up to speed on what mental health is and how to engage with individuals with mental health issues. We use a program called Mental Health First Aid, and we hope to roll that out to more community members as well. And then also more prevention efforts in those lines.
Well, great. There's much more to talk about, but I appreciate you all coming on and talking about this, and we'll continue our discussion on the web.
Thank you.